Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon, founder of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're gonna go through a patient journey, which is always so fun and insightful because it takes you as the viewer into the decision-making process, how we decided what procedures to do, the motivations behind the procedures, and also what healing looks like, and ultimately what somebody looks like several months later and how they feel about their overall outcome at that point. So without further ado, let's break it down. I'm going to introduce our patient. Her name is Helen. She's a local San Diego resident. She is a wonderful, wonderful, highly energetic woman. She's an influencer. And at age 49, she started noticing that for the last several years, there have been changes that are happening to her that are starting to change her trajectory from feeling as youthful and as vibrant as she feels on the inside. She's starting to see those changes manifesting, which then ultimately makes her more aware of it. And through a short history of trying non-surgical treatments, she came full circle to the idea that the approach to defy the aging changes are in fact going to lie in more of a surgical approach at her age and her stage of aging as opposed to the non-surgical, and she came in to see me. So let's take a look at her before photos and try to really break down what was going on, and I'll share with you how I assessed her and how I recommended the procedures. So when we look at Helen, you can see a beautiful woman, very, very beautiful jaw and neck structure, but there's laxity starting to set in. You can see the changes that are starting to happen along the jawline and loosening in the area of the neck. And this is an area where people feel very self-conscious about. They feel very self-aware when the jawline and neck area starts to change shape. The overall directionality of the face as it starts to become more elongated and more rectangular as opposed to more like an upside down triangle or a heart shaped as we kind of describe it as. When you look at her overall volume status, there's some loss of volume that's starting to affect underneath her eyes, around her temples. You can see it around the jawline area, this area we call the prejowl sulcus, and just overall throughout her face is a bit of volume loss. When we look directly at her eyes, you can see that her upper eyelids for the most part are in pretty good shape. There is some looseness and laxity affecting her lower eyelids. And these are the things that make people look a little tired. When you combine looseness of skin and loss of volume, the eyes start to become a little bit more tired looking. So when you put it all together, the shape related issues come down to laxity of the lateral brow, mid-face, jawline, and neck. This is a super common combination of changes that happen. It's pretty much how we all age. And there's also a deflation that's happening through the deeper fat pads that are beginning to get lost and some excess skin forming around her eyes. Now, when you look more carefully, her skin, she's enjoyed the sun over the years, and this is also something that she wants to directly address because the combination of affecting the facial shape and affecting skin is paramount in terms of making somebody look younger. So we're gonna address all of these components simultaneously, and this is how we decided to do it. So to address the laxity that's affecting the facial shape, I recommended a vertical restore. The vertical restore is a trademark procedure that I developed, and you can learn more about it in a lot of different videos that I produced here. And what it does is it addresses the neck, the jawline, mid-face, and lateral brow, which is a segment out here, all by lifting the face vertically. It's basically what you do in the mirror when you're kind of going like this and you're like, oh, I like the way that looks because it looks more like I used to. That is the impact or the result of the vertical restore, is by bringing everything up into this direction. And because it's going vertically and because it's directly affecting the deep plane, it's gonna be a very dramatic yet very natural looking change, which we all want. Then to address the volume loss, we're gonna do a full facial or customized fat transfer, which basically means I look at the whole face in totality and address a certain amount of fat to be injected and grafted into certain areas. So when we look at Helen's face, you can see there's areas along the regions where I just described that have lost some volumes, and those are the areas that will be fat grafted. Other areas that are full, like the cheeks, etc., they won't receive any fat transfer. Then we're gonna do a skin pinch to address the lower eyelid. by taking up a little bit of that skin, just the amount that you don't need for eye closure. That skin is removed through a pinch of the skin, and that cleans up that extra skin, especially when everything is brought up. That distance between the eyelid and the cheek is gonna shorten and that skin's gonna bunch. So it's extremely important to address that at the time of the procedure, especially with a vertically oriented lift. So these were the things that I recommended for her facial shape. I got her on the Karam MD trifecta to start improving her skin by decreasing sun damage and pigmentation, by improving pores, by overall improving the texture and the tone of the skin. In combination with the trifecta, I put her on polish, which is an enzymatic exfoliating scrub that she uses 2 to 3 times a week to further improve the quality of the skin over time. So we went to the operating room, and now we're gonna take a look at her during her healing process. As you can see during her healing process, the early stages of healing are very rough looking. The first 3 or 4 days, the first week is where the swelling is maximized. Everything looks distorted, unusual, but very quickly after that point, between week 1 and 2, there's a significant progression and rapid healing that starts to happen where the face becomes much more normal looking, and we call it restaurant ready, typically between 2 to 3 weeks after the procedures have been performed. Now, when you see her getting a little bit further out, she starts to look good, and you kind of forget the fact that she's had any surgery done. And let's take a moment and hear from her what her experiences have been like and what she thinks about the procedure in this little post-operative interview that she and I did. So we are here with Helen. Helen, how far are we at now?
Almost 4.5 months, I think.
We're 4.5 months out from a vertical restore, a fat transfer. And did we do eyelids too?
We did
the lower skin pinch, right?
Yes.
Yeah. This is actually, you normally will go into it a little bit later, but one of the most amazing things is not only do you look incredible, but you can't even see incisions. And that's part of the thing is, like, unless I look back at the notes, I can't tell you've had anything done, which is so awesome.
And I don't even see my incisions. Like, I forget that I have them.
That's so awesome. So Helen just turned 50, literally just like a couple weeks ago, right? A week ago or something. 10th. Yeah. So this was a nice timing right before the 50th, right? Mm-hmm. To kind of just to make you look as young as you feel, because obviously anyone who knows you, have seen some of your stuff on social media, knows like you're a super young person at heart, and to have a face that matches that spirit is what this is all about. How's it been for you so far?
I love it. Yeah, I don't regret it. Doing it at all.
Yeah, it was a good timing because things were just starting to kind of show the signs of aging, and you nipped it in the bud right away.
You know what? And that's the thing, because I really didn't want to wait until I really looked old. I wanted to take care of it before it got to that point. Yeah. And then 2, it was all preparation for my big 50th birthday. So.
That's awesome. That's amazing. So let's take a quick look at the incisions, if you don't mind. So as we're looking here, the vertical restore incisions start up in the hairline. They come down around here. They go behind the tragus, and then they come around here and behind the ear. And already in four months, you literally cannot see the incisions underneath the eyelids. Let's take a look here. Look up for us for a moment. The incisions are actually up in here, and you literally can't see them either. I love it. It is really, really beautiful. And you're taking care of your skin with the trifecta at this point?
I am, and I just say I love it. I just doubled up on all my stuff, and it was still, it was a tiny bit more than what I would spend on one moisturizer.
That's amazing. I always tell people it's you're getting 20 active ingredients in addition to all the other kind of foundational stuff. And it's all around relatively inexpensive comparative to what you would spend normally.
Totally, and I love the way it works, and I love because too, I seriously was using, I think it was 9 to 10 products.
Yeah.
And it would take forever, and I'm kind of lazy.
Yeah, no, it's incredible.
So I love just 3 things. Yeah. Actually the 4, because I like the polish. I put it with my cleanser.
Yeah. Oh, you put them together?
Yeah, I do it.
Yeah.
I don't recommend it.
I don't know. I've never tried it that way. But
I just put it with my cleanser, and it's still just 3 steps.
Yeah, that's perfect. No, it's perfect. So Helen, one of the things I love about the outcome is when we look at the shape of the jawline. Let's look straight up here. It's this gorgeous V shape, right? Up here, mid face is up, the lateral brow is up. This whole effect, and of course, obviously the neck, it just creates such a youthful all-around shape, which is really what looking young is about. Is like young looking skin, young looking facial shape combined together, and there you go. You have it all. I love it. Well, thank you so much for sharing your journey along the way. That's so great when patients do that, and you've been so generous with all your photos and different aspects. So it helps. I know a lot of people out there figure out what's right for them and how they can relate to the changes that you are having and the anatomy that you have. So they feel more confident moving forward.
I'm happy to help.
You're the best. All right, thanks, Helen. So as you can see, she's obviously extremely excited and happy with the outcome. She produced this incredibly cute video that she made for TikTok and Instagram that blew up and went crazy viral. Basically her defying the 50-year-old birthday that she's about to have in her unique way. Let's take a look for a second. Her fans have loved it. As I said, she's an influencer and has done a great job with her social media output. And I think looking as young as you feel stimulates a lot of that type of desire to put yourself out there, especially at the age of 50, and not feel dampened or self-aware by the aging changes that are happening. And that's really ultimately what it's about. It's about helping people get that vibrant spirit up to where they expect to feel on the inside whenever they look in the mirror and they see themselves. And so when those two things come together, that's amazing. And now when you look at her skin over time, you can see how unbelievably she has responded to the trifecta in the skincare routine and the sun protection. You can see the quality of her skin has just improved significantly. And year after year of this type of an approach postoperatively, between the use of good skincare, between sun protection, between use of some in-office treatments like microneedling and anything related to improving specific problems, her skin is just going to continue to blossom and improve despite the fact that she's seen a lot of sun over the years. I am so happy for Helen. She's one of our favorite patients, and we've really gotten to know one another, and I love the fact that she's shared and supported women out there by sharing her experiences literally with millions and millions of people. And I think she deserves a lot of credit for that bravery and honesty as she faces aging and tries to help other people understand how they can also face it as well. All right, folks, I hope you enjoyed that video. If you haven't already, hit subscribe, follow along. There's more journeys, more education, more skincare. Share this and send it along. Like it and comment with any questions or thoughts you have. I love hearing and reading about those things. All right, folks, thanks so much. Dr. Amir Karam.